everybody. My name is Matt Jensen, Director of Marketing here at Lakewood Health System, and we want to thank you all for joining us today for Lakewood Health System's very first ever video podcast, Healthy Conversations, with a splash of orange, right? Got to get some orange in there, too. I am surrounded today by three wonderful individuals, team members of mine at Lakewood Health System. Thomas McCall, Director of Radiology at Lakewood Health System. Thomas has been instrumental in bringing new imaging technology like our 3D mammography and soon breast MRIs to our patients, coming soon in August. Dr. Emily McGovern, medical oncologist at Lakewood who works closely with patients throughout diagnosis, treatment, and beyond. She also has a special interest in breast cancer and solid tumors. And then finally, Dr. Stephanie Kray, family medicine provider at Lakewood Health System and an advocate for women's health. Welcome, everyone.
Thank you, Matt.
It's exciting.
Yeah.
Get this started. I know, right?
Yeah.
Exactly. We also want to thank our friends at Sourcewell for giving us this fabulous space and allowing us to have this opportunity. So thank you very much. It's been fun. So let me sort of set the stage for the conversation, if I could. Our topic today is Screening Smarter, Lakewood's new era of breast imaging. So as many people know, and certainly the three of you know, we are inching ever closer to the opening of the Lakewood Cancer Center.
Yes.
This brand new building. Super exciting.
Very.
Construction's been fast and furious for over a year now. We're getting closer, and we are looking at an October timeframe for the opening of that building, so extremely exciting. And one of the things that we wanted to talk about is obviously start to tell that story. Some of the new diagnostic testing that we have available at Lakewood Health System, sort of talk a little bit about the family medicine element and just how important that is in continuing that patient care and so forth. So one of the things that Lakewood has really hung its hat on since its inception is outstanding primary care, right? It's one of the things that it's the lifeblood of everything that we've done, and it continues to be to this day. And so, Stephanie, I'm probably going to start with you in this conversation, is we thought it would be really important to sit down and talk a little bit about, as a primary care provider, certainly you've seen women come through your practice that have had a breast cancer diagnosis. And we'll use that for the sake of this conversation. What does it look like for you as a primary care physician following that patient along that treatment journey, and how important is it for that collaboration between oncology providers like Dr. McGovern to have that really close relationship? And maybe walk us through that a little bit, if you could.
Yeah, it is. My role is unique, I feel, in a lot of ways. And I guess before we get into cancer diagnosis and with the theme of the talk today, I think it's important to speak of the unique role of primary care. Have the ability to try to help people decrease risks, to try to keep them healthy, try to be really aware and have good discussions about the importance of screening for cancers. And breast cancer, certainly that's something we've been doing for a long time and been doing very well at Lakewood for a long time. And we will speak more in a bit about some specifics of some exciting changes coming our way. Sometimes things are really straightforward. Sometimes they're very complex, and that's where I feel so fortunate to have such a great team with the oncology providers and their care teams and radiology, where it's a phone call or a medium walk down a hallway to ask questions and try to just really make sure we are doing the best we can for our patients.
Absolutely. You know, I don't think a lot of people realize that, but certainly, TJ, we know it. Like, they're literally down the hall from each other, right? Yeah. So it's not a situation where we've got an oncology provider in a different facility, in a different location, in a different community. You can walk down the hall if you have a question for Emily and have that conversation, right?
Or vice versa.
Or vice versa, right? Which I think is unique.
Yeah,
I think it's really powerful too that you guys can just quickly do that and have those kind of hallway meetings, if you will.
Lots of benefits to that.
Yeah, for sure.
Absolutely, for sure. So same question for you, Emily, from your perspective on the oncology side of things. How does the collaboration with primary care providers impact the patient experience and outcome, in your opinion?
It's a large part of the journey, I would say. We see a lot of new breast cancer diagnoses, and their journey doesn't start with meeting me. It really starts with their primary care provider ordering a screening mammogram, talking them through the risks and benefits, and then delivering those results. And so I'd say probably at least a quarter of that journey of a breast cancer diagnosis isn't from me. It's from primary care. It's from radiology. It's from the pathology group and from our navigators who do, I think, an awesome job of getting them into that doorway.
fantastic. And like I said, that constant communication back and forth, if it needs to happen, is available, right, for you to do that as well too. Excellent. So that leads us on to some of the new tools that we have available to us. TJ, we're going to pull you into the conversation now at this point. In July, we took a big step forward in breast cancer screening with the launch of our new Smarter, Gentler, Genius 3D Mammo campaign. The billboards are up.
They
less squeeze, more ease, right? And so tell us a little bit about what is Genius 3D mammography and how is it different from traditional mammograms?
So historically, we've always had 3D. That's what our old machine was, 3D. We had 3D. So that's technically not new.
Yeah.
But the technology that is in the machine is new.
Absolutely.
And the Genius technology combines new imaging receptors with AI so that we can detect these cancers better, even with patients that have breast density that's really, really dense.
Got it. So talk a little bit also about the less squeeze, more ease campaign. We also talk a lot about there's a smart curve technology that's a part of this as well. Correct. Can you educate us a little bit on that too? Because I think hopefully this is going to be a much better experience for women as they go through these 3D mammograms. Is that right?
Definitely.
We're not able to really speak to that as well as these ladies, of course, but tell us a little bit more about that.
Yeah, that's the most exciting part of the new machine. A lot of women are apprehensive because they don't want that body part compressed. They hear horror stories and they get scared and they're like, I want nothing to do with that. Well, this new technology uses a smart curve panel instead of a flat curve or flat panel. So it conforms to the shape of the breast naturally. So it displaces the pressure. So there's less pinching and improved comfort for the patient.
Oh my gosh. Sounds amazing.
It is amazing and a unique thing to be able to offer. The billboard's interesting.
It is.
It is. We like to do things that catch people's attention, Stephanie.
Success.
Well, even in the first week of having the machine, we've been getting constant feedback from patients like, wow,
that's so
not bad at all.
outstanding.
It was way better than last year. It was way better than last year.
That's fantastic.
So it's nice to hear that feedback.
Absolutely. That's fantastic. So Dr. Kray, Dr. McGovern, how might a 3D mammography impact early detection, especially for women with dense breast tissue? Talk a little bit about that.
It's a huge deal. Younger patients particularly tend to have denser breasts, and so with the mammogram recommendations now being at age 40, we're catching a large population of people that have dense breast tissue, and those are always really tricky for radiologists to be able to pick up early disease states at, but with this technology, we're able to get a much better picture. It actually helps our radiologists pinpoint which areas to better look at so that they aren't straining their eyes or missing something. AI does a little double check for them. And it just leads us to having earlier diagnoses for patients, which is always the goal.
That's fantastic. Thomas, talk a little bit about how quickly after receiving this will women get their results? What kind of turnaround can they expect with that?
Typically 24 to 72 hours for screening.
Okay.
Now, if you have it come in for a diagnostic, so you've been called back and we need to take a closer look, you will get same-day results.
Same-day results.
As well as have a same-day ultrasound.
Okay.
And if a biopsy is needed, we will get that scheduled with you that same day for a later date.
Outstanding.
Which is
That's
typically
great.
within a week.
Okay.
Yeah.
All right.
Yeah.
I would like to add another important piece with the added technology is a barrier that I've noticed women complaining about or being concerned about is the callbacks. And then there's what we call a false positive, or there's thankfully good news, but it's a lot of anxiety. It's also cost for some women, and it seems like, at least the data with the newer technology, those callbacks should be cut down significantly as well. So that's something really exciting for me to be able to talk to women about.
Absolutely. Talk a little bit more about that. How do you go about talking to your patients about screening options? Walk us through sort of a typical scenario for you with women.
Well, thankfully, it's often very simple because there are a lot of women who have been getting mammograms and the experience has been good. And then, quite honestly, I don't go into much detail at all. We just, keep track. If someone has reluctance, then I try to meet them where they're at. Why are you reluctant? Is it the pain? Has it been really uncomfortable? And truthfully, I didn't have a good comeback line for that except to encourage them to move forward with it. So it is very exciting to be able to truthfully say, you know what, I'm really hopeful this is going to be a better experience for you. And I've had some reluctance with people who've had callbacks and have had some extra costs. So I'm very much looking forward to being able to, again, honestly say that there's a less of a chance for that, but try to see what fears or concerns are maybe acting as barriers, and just emphasizing that, like a lot of things in medicine, it's not perfect. It's not a perfect tool,
Right.
but it's a good tool, and early detection really matters with not just survival, but also the path and the journey you might have to take to get to that point can be very different if we're lucky enough to, get a good early detection with a breast cancer diagnosis.
Catch it early. Absolutely. Thomas, you mentioned we've been doing these for a week now. This is up and running. Women can schedule these today if they would like to.
Yeah, we've actually been up for a couple weeks.
Oh,
but
fantastic.
yeah, you can. It's ready to go.
It's ready to go.
So
how
if
do I go about scheduling? Let's let people know that if they're out there watching right now.
So if you have an order put in by your primary care provider, you can just give radiology a call, radiology scheduling, and we'll get you on the schedule.
Fantastic. All right.
Yeah,
That's great.
it's pretty easy.
Pretty easy. I love it. Let's make it easy. And then
Yeah.
transitioning then to another new technology that we are going to be putting in place here soon. Another exciting development coming this August, so coming very shortly, is the availability of breast MRIs right here at Lakewood as well. So what is a breast MRI, Thomas, and who would benefit from getting a breast MRI?
So easily put, a breast MRI is an MRI of the breast, typically bilateral, and we typically see patients that have really dense breast tissue that have these performed. It could be a younger patient as well that we don't want to radiate using mammography. So it gives us a closer look through those tissues to try to see what's going on in that area.
Got it. Emily, what do you think about these? Tell us a little bit about your perspective on that.
So breast MRIs are very important to me as a medical oncologist. They can help us dictate a lot in terms of staging of disease and figuring out which path is best for the patient. They're also super helpful in our high-risk population. So, people who have had a strong family history of breast cancer or have genetic mutations that put them at higher risk of breast cancer, it's really essential for getting a full picture of that breast tissue. So we use it a lot for if there's an ultrasound that's been done and a mammogram that's been done and there's a size discrepancy based off of each of those images, then it's really recommended that we get a breast MRI so we can figure out exactly how big the mass that we'd be dealing with is. And as you can imagine, knowing the size of a breast cancer is super important in figuring out stage, and we can't come up with a plan unless we know the stage. So I will find it really helpful to have, and I think it's awesome that we're going to have it at Lakewood because we previously have been sending people, sometimes an hour away to have this done.
To have this procedure done. Got it. And have it right here in our backyard.
Yeah.
Fantastic, right? All right, next question. Emily, I wanted to ask a little bit about, are there situations, and maybe walk us through it, where a 3D mammo makes more sense versus an MRI, or are there situations where both might be helpful?
Yeah, good question. So 3D mammography is really, it's standard of care for anyone over the age of 40, as well as high-risk breast cancer patients, or not breast cancer patients, but high-risk individuals for breast cancer. And in some of those instances, we add a breast MRI as a second layer, particularly in that high-risk group. We tend to alternate between a regular mammogram or a 3D mammogram and a breast MRI every 6 months. For other people who are not in that high-risk category, but have a mammogram, ultrasound, and there's discrepancy in size, or we still don't feel like we have the full picture of what's going on within the tissue, then a breast MRI is indicated for them as well.
Okay, got it. Interesting. Talk me a little bit about, maybe you mentioned this already, Thomas, but turnaround time in regards to test results from a breast MRI. How quickly can we see those if I'm a patient at Lakewood?
About 4 business days
About
for
4
those.
business days?
Yep.
Okay, got it. All right. So to kind of wrap this conversation up, I want to do a little round robin now. Thank you for sharing all the wonderful details about the new technology coming and some of the new advances here as we get closer to the Cancer Center. What are you most excited about, round robin style, about the new Cancer Center? What excites you the most, Thomas, about that place opening up in October?
I think just bringing that care to the community here, where patients don't have to go all the way to Fargo. They don't have to go to St. Cloud. They can stay right here. And they're around people that they know. They're around their family provider that they're going to see in the hallway when they're coming down to see you. It's just that comfort state, to keep them close to home. And it's going to be really exciting.
Makes a huge difference, doesn't it?
It does.
Mhm.
I mean, we all get our care here. We don't want to go anywhere else.
Exactly.
We know what care we offer, and we want to keep it.
Absolutely. Emily, what are you most excited about?
I'm really excited for exactly that. TJ just said, talking about just proximity, but I think the piece I'm most excited to have near us is radiation oncology. We refer a lot of patients for radiation oncology at some point in their cancer journey, and it's never that close to home. And so our chance to have that here is just incredible. It's going to save so many hours of travel, so much stress for patients, and it's going to be wonderful.
Because a lot of those radiation treatments, they can be a 10 or 15-minute appointment, right? And if you have to drive hours to get there, it's just crazy.
Yeah, they're usually daily, or about 15 minutes in total. And for breast cancer, for example, it can be 25 to 30 treatments. So that's a lot of time spent on the road.
Yeah.
That's
Unnecessarily,
yeah,
right?
and away from family, away from work. A lot of time spent in the car.
Yeah, no, not fun for anybody.
No.
Stephanie, what are you most excited about with the Cancer Center?
Ooh, lots of things. I was able to get a sneak peek of it and was amazed, quite honestly. I think the main thing is, our quality oncology, cancer care has been there, and I think, we can't forget that, and we have been offering a lot of services. But I know patients to get like some of the surveillance screenings, like the PET CT, they were, in the truck. That's all going to be. I kind of look at it as their little home within the home.
Yeah.
It'll just be easy to navigate. I think that'll just feel more comfortable. Infusion area will be, some people more similar to them. They'll get really used to that process and still close to where they get their other primary care things. And I think that's amazing. And of course, I still am pinching myself that we're going to have radiation available locally. That's wonderful as well.
Huge differentiator, isn't it?
Big
It's fantastic.
accomplishment.
Yeah. What am I most excited about? Just to tell this story. It's been so much fun. Every time we get a little bit closer, we've got some new campaigns coming out here very, very soon. The one that I'm most excited about is we've shifted the tagline of the Cancer Center a little bit to "Hope has a new home." And I just love that because it's so powerful, and hopefully it resonates with patients that are out there. And I know how difficult this journey can be. My wife is a breast cancer survivor. We've been through some of the very things that you're talking about, and to have a place like this right here in our own backyard is amazing. So I'm excited about it. So thank you all for joining me.
Thanks for
Yeah,
having
thank you.
us.
I think you guys knocked it out of the park. Great job.
So did
and
you.
Well, thank you. I appreciate it. And so until next time, thank you for joining us, and everything's better with a little splash of orange. Talk to you again soon.